Good morning to everyone who's joining us, and welcome to Councils and Conversation. We'll get started in just a few minutes. Good morning. If you're just joining us, we're going to get started in just a minute here, and thank you for joining us for what we used to call our morning mingle, but now Councils and Conversation. All right, we'll get started. Thank you, everyone, for joining us this morning. My name is Garrett Sheehan. I'm President and CEO of the Greater New Haven Chamber of Commerce. We normally would be holding our morning mingle on a Wednesday morning like this. We've changed the name and we've changed a few things, obviously, because of everything that is going on. So we are really pleased to welcome you to our first Councils and Conversation, C-squared as we're calling it. Just a new way of emphasizing what we do at the morning mingle, because so much of the morning mingle is the programming that we have, and we thought that we needed to emphasize that more. It's a great point to make this morning because we have an excellent panel coming up in just a couple of minutes. We're all in this together, collaborations to build strong, inclusive communities, and we're excited to hear from our panelists. Obviously, things are going to be a little bit different with this format. It's not because of the name change, but because of the situation we're all in. Normally, we do like to have a lot of mingling, a lot of conversations, and that's going to be a little bit limited, obviously, in this virtual environment. But as soon as we can get back to our in-person councils and conversations, we will do that and make sure that we have plenty of time for people to mingle, meet, and network before we get into our panel conversations. But today we're going to get right into it. I want to first start off by thanking Southern Connecticut State University, the School of Business, for being our host. We had been planning to be at the School of Business on this morning, but obviously we're here, but we're there in spirit, and we'll be hearing from Southern in just a few minutes. Also, all of our councils that make up the programming for the Morning Mingle programming. So that's the Small Business Council presented by Kyber Security, our Healthcare and Life Sciences Council presented by Martha Kalina, and our Energy Roundtable. Now, each of them would have had a presentation for this event, but even before COVID-19, we had decided to pull together all three of those councils for putting on one full panel and program that touched a little bit into all of those areas just from a business sense. And so we'll have more on the panel in just a moment. We really are proud to be partnering with Southern Connecticut State University School of Business for this webinar. We thank them again. I also want to take a very quick moment to thank all of our investors, our premier investors. It's all of our investors that allow us to be able to continue to operate as a chamber during this difficult time. Their support of the chamber over the several years, as well as right now, is what is keeping us going. So I really do want to make sure that I recognize all of our investors, and we do have so many, so thank you to them. At this point now, I'd like to turn it over to Dr. Ellen Durnan, Dean of the School of Business. Ellen?
Good morning, everyone, and thank you, Garrett. Welcome to the Chamber's first Council and Conversation. We had planned to host you on campus, but it is still so important that we connect in this way. I think that we have a very timely program for you this morning. We are pleased to be the co-hosts of the event, and I would like to thank Garrett and his team for how nimble and responsive they have been to the pandemic and its aftermath for our community. The Chamber has truly emerged as the business advocacy organization for the region. Today's presentation, We're All in This Together, Collaborations to Build Stronger, Inclusive Communities, is a message that resonates with Southern at all times, but particularly now. Community is important to Southern and the School of Business for so many reasons. Just a few statistics about us. More than 95% of our students are from Connecticut. Our student population reflects the wonderful diversity of the area, with more than 50% of our students being the first in their family to attend university. And those students continue to be members of the local community after graduation, with 85% of our graduates living, working, paying taxes, and giving back to the region. How does Southern demonstrate that we're in this together? Right now, thousands of Southern trained nurses and healthcare workers are on the front lines in Connecticut hospitals and clinics. Thousands of Southern educated teachers, principals, and administrators are teaching students and keeping our education systems operating remotely. And thousands of Southern trained accountants, financial consultants, and business owners are working to keep commerce afloat during a great time of stress for our economy. Southern is one of the region's largest employers, and we prepare the region's workforce. It is critical that we collaborate with you to ensure success for employers and their organizations. And Southern School of Business is doing our part. As part of our Change for Good mission, I provide a few examples for how we are collaborating. First, our new Impact New Haven program, which provides paid internships to business students in local nonprofits, many of which will be facing funding deficits at a time of increased need. The vision for this project came from one of our alums, Jerry Brennan, and in the fall, God willing, we will be able to provide at least a dozen internships at area nonprofits. Another example, the VITA program, where our accounting students prepare free tax returns for members of the community. And the incorporation of the United Nations 17 Goals for Sustainability into our mission statement and our curriculum. We funded a group of students to travel to Morocco last year to participate in a World Merit Student Leadership Program last spring. And finally, our Women's Mentoring and Leadership Program that provides tools for our women students to overcome obstacles that still exist for women in business and brings members of the community and students together. It is critical that we partner with you to understand your needs so that we can prepare the skilled workforce that you require. And now it is my distinct pleasure to introduce the members of the panel. I am proud that Kyle, Lakeisha, and Garrett are members of my Business Advisory Council, and Brian is a recent graduate of Southern Connecticut School of Business. First, Kyle Ballou is Vice President for Community and Government Relations at Yale New Haven Health Systems. Good morning, Kyle. Next, Lakeisha Jordan is Corporate Responsibility Officer for KeyBank, Connecticut, Western Massachusetts, and Hudson Valley Metro, New York. Lakeisha, great to see you, even though it's remotely. And finally, Brian Sapione is Membership and Marketing Director at the Naugatuck YMCA and a founding member of the Student Conscious Capitalism Chapter at Southern Connecticut State University. Morning, Brian. And now I turn it over to our facilitator, Garrett Sheen.
Thanks, Dean Duran. Appreciate it, and thank you to our panelists. Just a couple of things before we get started. I do want to recognize the Connecticut chapter of Conscious Capitalism. They really helped to inspire what we wanted to do here today. And also, you can either put in your questions in the chat box or the Q&A. We're going to talk for a little bit, but then we'll start looking at those questions and try to get as many of them answered as we possibly can. You heard the theme, we're in this together. This is what we wanted to talk about even before COVID-19 struck, and we wanted to talk about how companies, businesses, organizations in this region give back the corporate responsibility that they show for our entire community and creating an inclusive community. So I'm going to start with Kyle. We have some slides for each of our presenters. We'll go through those, and again, then we'll start a dialogue and we'll take in your questions. So Kyle.
Great, thanks, Garrett. Good morning, everybody. I'm very happy to be here. Would have liked to have seen you all in person, but it is what it is, and we're all getting through this together. So as Garrett mentioned, I'm here to talk about the corporate social responsibility for Yale New Haven Hospital. I'm also responsible for corporate social responsibility for the health system. So that includes, for those of you who may not know, Greenwich Hospital, Bridgeport Hospital, Yale New Haven Hospital, and Lawrence Memorial, and including Westerly Hospital in Rhode Island. Next slide, Garrett. So I'm sure all of you have seen this. This is our vision, mission, and values here for our health system as well as all of our hospitals. And I'm not going to read it to you, but I wanted to make sure that everybody realizes this is a slide we have for every presentation that we do, and it's our guiding star. It's our North Star. If you look down under integrity and accountability, those are the responsibilities that I think are most important to what I do. Doing the right thing, I mean, it sounds kind of trite, but it's very, very important. And you're responsible and taking action when you see something that's not being done correctly. Garrett, next slide, please. So this is what we call our wheel, which sounds pretty simple, but a few years ago, we started looking at all of our donations. The federal government requires us now to look at our community health needs. And we do a community health needs assessment every 3 years. And we've done, I think we're going into our third one that we're doing. And we have to do presentations. We have to do collective reviews throughout the region. We do these with other organizations. So it's not just us, but we look at the collective needs of the community. And what we have found over those last 2.5 to 3 reviews that we've done is there's a consistent theme of causes of concern in our community: asthma, diabetes, and obesity. Those are the top 3 that rise to our to the top. And we also took an analysis. This wheel shows an analysis of where our money goes as far as our needs in the community. So I'm not going to read it all to you. I think you can see it on the screen, but the lion's share of that is guaranteeing access to care. And that includes our spend for Medicaid and Medicare under reimbursement. And as you can imagine, a lot of the needs that I just mentioned, asthma, diabetes, obesity, those are actually prevalent in the Medicaid community. So what we decided to do is we really need to treat not the problem, but we need to treat the symptoms. So we don't want to treat people when they come to us because they have a problem. We want to treat it before it becomes a problem. So we decided that we would look and see what people need, what they want and what they need. And one of the several of the things that came to mind are safety. People want to be safe in their homes, good food sources. We all want that, and clean places to live. And why are those important? Well, if you feel safe in your neighborhood, you're going to get out, you're going to walk, you're going to be exercising. Obviously, if you want good food sources, you want healthy food. Fast food is not always what you need to be eating, and probably some people would say you never need to be eating it. And then clean places to live. That includes, causes of asthma and other diseases. So we looked at all of those and we decided to change what we had been supporting over the last several years. And so this wheel gives you an idea, and this is back to 2018. We're always lagging a couple of years as far as reporting on this is, but these are the places that we're putting our dollars, and we're trying to expand those so that the blue part of the wheel becomes less and the other parts become greater. Next slide, Garrett. So what are the organizations that we work with? We actually started funding education and workforce development. Those are important, obviously, because you have a good workforce. A great education gives you a good workforce. Some of the things that Dean Durnan just talked about, we support Gateway Nursing and Allied Health, CONCAT, school to career programs, then the safe, affordable housing. We actually have, you can see it here that we have several programs that we partner with, but we actually have something called the HOME program, which I want to spotlight here. This is a program where we actually give monies to our employees to buy houses, first-time home buyers to buy a house in New Haven. Good neighbors make good neighborhoods. And we figure our employees are the best people to make good neighborhoods. So we have incentivized our employees to go out and buy homes in the New Haven area. And depending on where you are in New Haven, you actually get an extra bonus. We've worked through Key Bank on some of this, and this has been a really popular program. Nurturing children and families, prenatal and beyond, that goes to the good, healthy food and care. And we work with the school-based health clinics. We work with the supplemental infant programs and Healthy Start. And what's all of this resulted in? Back in 2017, and I think some people are tired of hearing me talk about this, but it's really been a capstone in my career. We actually won a prize from the American Hospital Association and Baxter International called the Foster G. McGaw Prize. And this is a very coveted prize for all hospitals throughout the United States. There's about 4,000 hospitals that compete for this every year. And we won this in 2017. And it shows us that what we've been working on is really starting to work. So we were pretty pleased with that. So I'll stop there. Happy to take questions when we're ready.
Great, thank you, Kyle. And now I'm going to turn it over to Lakeisha, and I'll get your slides up. Here you go. Lakeisha, thank you.
Hi, Garrett. Thanks, Garrett. Good morning, everyone. As Garrett mentioned, I am the Corporate Responsibility Officer at Key Bank, and in my role, I serve as the liaison between the bank and our local communities to execute Key's broad community engagement strategy. Key has a long legacy of fair and responsible banking, and we focus on delivering financial wellness to our clients, employees, and our communities. We've been widely recognized for our commitment to corporate responsibility, sustainability, and of course, diversity and inclusion. We've earned 9 consecutive outstanding CRA ratings. Together with our community partners, we have lifted our neighbors and neighborhoods through our lending and investments, as well as our charitable giving. In 2017, we introduced our Community National Benefits Plan, which is a 5-year, $16.5 billion investment across our 15-state footprint, supporting our low and moderate communities. Currently, we're in year 4 of this plan. And as you can see on the slide, we've invested more than $325 million in Connecticut over the last 3 years. These investments include $160 million in our community development and lending projects, $53 million in small business lending, and $104 million in home mortgages. We also have invested $3 million in our transformative philanthropy, providing grants to many of our nonprofits focused on education, workforce development, and neighborhood revitalization. Kyle mentioned a number of Yale New Haven Hospital's community partners. We also partner with many of them in the New Haven region, including CONCAT, Connecticut Association for Human Services with their Bank on New Haven and VITA programs, our community colleges, including Gateway and Housatonic, the Food Bank, and many, many more. Our community engagement also includes our volunteer efforts of our employees. We have a strong presence of nonprofit boards and advisory councils. Ellen mentioned that I serve on their business council as well. We sponsor many charitable events, fundraisers, and our employees volunteer providing financial literacy workshops. We serve as youth mentors as well as event organizers. Next slide, Garrett, please. Our commitment to our communities has never been more important than it is today as we deal with the health and economic impacts of the COVID-19 pandemic. I just want to take a moment and say thank you to Kyle, Yale New Haven Hospital, and our essential workers across the country as they are the frontline heroes of this pandemic. Of course, our branch staff are also essential workers and continue to serve our clients through our drive-up windows and by appointments. Our staff is also available around the clock by phone and online. We have relief programs in place for those experiencing financial hardships, including payment deferrals, fee and penalty waivers, and personal emergency loans. As millions receive their stimulus checks, we have adjusted our check cashing policies to ensure the full benefit of those payments are achieved. We've waived deposit hold, making funds available immediately. Our overdraft balances of less than $50 on the day of direct deposit have been waived, and overdrawn balances greater than $50 are suspended for 30 days. We also have instituted a no-fee check cashing policy for non-clients. Of course, our small businesses are the backbone of our communities, and as an SBA preferred lender, our bankers have been working around the clock to continue to assist our small businesses to secure SBA funding. Our foundation has directed $6 million to the COVID relief efforts across our footprint. Those grants have been made to various community foundations. In this market, we've worked with the Community Foundation of Greater New Haven in partnership with United Way, as well as other foundations in Fairfield and Hartford. The bank is also matching employment donations made personally on behalf of our employees at a 2-to-1 rate. As of last week, the donations have reached $600,000, resulting in $1.2 million of support with Keys match to nonprofits. I'm extremely proud to be part of an organization that is dedicated to supporting the community we work and live. Key is committed to ensuring our neighbors and neighborhoods thrive, and we will continue to demonstrate this through our business practices. I look forward to taking any questions during our Q&A session.
Thank you, Lakeisha. Appreciate it. And now we'll turn to Brian. And again, you can put your questions into either the chat or the Q&A, and we will have a panel discussion in just a few moments. So Brian.
Thanks, Garrett. So the Naugatuck YMCA, which the YMCA has been founded over 175 years ago by volunteers. I think this is something that speaks to how community really is embodied in a small town like Naugatuck that actually has a vibrant community. So the 3 pillars that support our mission are youth development, healthy living, and social responsibility. And those 3 things have thrived both before current things that we're going through with COVID. It's shining light through now, and it kind of realters our mission moving forward, but we adjust and pivot. So the 3 programs, one that's highlighting our youth is the Triana Rossi boxing program. These fundamentals are instilled at a young age where we can really understand for youth to understand discipline, develop good sportsmanship, gaining self-confidence, self-control skills, which really lead into how we shape our community. Healthy living. In terms of membership and fitness, we have 1 in 5 Americans are members of health clubs. That's a tremendous opportunity. And for our Naugatuck YMCA, we help develop the employees as well as the ability for us to reach out to the community through that. Our social responsibility is an integral piece where our entire team is extremely invested in the community, giving back, developing innovative community-based solutions, and bringing about meaningful changes, really supporting the mission. Ultimately, this is something that I've learned from my experience going through Southern and its ability to shape and mold me and my career, and how I believe that giving back to the community is a tremendous part of what the Y's mission is. And I think we're able to really support that through different programs beyond just youth development, healthy living, and social responsibility.
Great, thank you, Brian. And again, thank you to our entire panel. So I'm gonna ask some questions here. I'll throw it up to the panel, and I see that we're starting to have a few questions on the chat as well. You know, the first question from me is, how have your organizations been able to take the activities that you do from the outward side, the incredible donations and giving back? How do you bring that to your employees and make them a part of it, make them feel like they are have the opportunity to give back to their communities through the company overall? And anyway, Kyle or Lakeisha or Brian, even what you see. Lakeisha?
So at the bank, we have, as I mentioned, we have the 2-to-1 match for charitable contributions that we have supported. But additionally, we have volunteer opportunities. So we pivoted from, for example, we have our Neighbors Make a Difference Day, which is an annual event that Key has hosted for many, many years, where we shut down our banks and come together as an organization, everyone across our footprint, and we volunteer for 4 hours on the same day. Unfortunately, our Neighbors Make a Difference Day has been canceled in person for this year, but is pivoting to a virtual platform. There are opportunities for our employees to sign up for virtual projects through our online internal networks, and that day will happen in June. I believe it's June 2nd. Additionally, we also have other virtual opportunities that we've provided where we are encouraging our employees to participate there's read out louds, tutoring, mentoring, just to name a few.
Thanks, Lakeisha. And Kyle's back with us. Kyle, anything, and I know your audio is connecting right now, but anything that you'd want to add just about how you guys engage employees? I know the employee part of it is a big piece. Kyle, can you hear me?
Yes, I'm sorry. I lost you there for a minute. What happened?
No problem.
Garrett, can you hear me?
Yep, we can hear you. You're good.
Can you hear me?
Yes.
Yes.
Hello?
Yes, yes.
We can hear you.
We can hear you.
I think Kyle's, we're having a little bit of trouble with Kyle's line. I think she can't hear us. So Brian, let me turn to you for a moment. And I know you helped found the Conscious Capitalism chapter at Southern. What drove you to that, and how have you carried that forward in your position with the Y?
Absolutely. So conscious capitalism is as a integral part of my DNA. We take into account the stakeholders and how the stakeholders are affected, and that's not just those in the business, but those external to the business, the companies, the vendors, also the employees of the vendors. This conscious capitalism is something that I was very passionate about when I was able to have the opportunity to found it at the School of Business at Southern. It really spoke to me, and that was something that has shaped my path in giving back to the community. And I embody that in the work that I do in my day-to-day. That's something where I developed at the School of Business and had the opportunity to work on connecting businesses through conscious capitalism with their interest in giving back and having a more than just a bottom line, and have that derivative figure going to supporting the community. So that's really what landed me at the Naugatuck YMCA. And for us, our employees are able to really embody giving back. And as we have pivoted with everything going on, you know, we've changed our mission from servicing those that come into our doors to servicing them in ways that we can give back. So if that's giving a call to one of our 600 community members of our seniors, creating food insecurity options for them, being able to drive them to doctor's appointments, call on them and just have conversations with them. That's how we have embodied giving back to the community, and how our employees our team is really embodying that by continuing to serve them.
Oh, thanks. Appreciate it. You know, obviously, when we planned this, we were just in a pre-COVID world, but with the COVID outbreak, you know, nothing really puts the rubber to the road as far as, you know, how companies respond. And we've seen across the board a tremendous corporate response in this situation. Lakeisha, I know you touched on it a little bit in some of your slides, but what are some of the ways that you guys have been able to not only support customers, but also employees as well during, you know, what's been an extremely challenging time?
The organization has allotted for employees who have the capability to work from home. Others that do not, are essential workers, have flexible work schedules. We have supported that line of business with additional pandemic crisis pay, as well as providing child care stipends. Our employees are also have the opportunity. If there's a reason to believe that they are positive, the bank has waived co-pays and fees around testing, so they do not absorb those costs. There's also other employee support services that have been put in place as need be. So our resiliency plans are in place and fully supported across the organization throughout all our lines of businesses.
And I'll stay with you, Lakeisha. You know, there's been lots of different headlines about the Paycheck Protection Program. You know, a lot of snafus that have occurred at I'll say at other banks. But you know, from what I know about what you guys have been doing at Key and from many of our other banks that part of the chamber, I mean, it's been a Herculean effort of everyone coming together and trying to get out a brand new program as fast as possible and reach as many small businesses as possibly can.
So as of April 16th, and of course these numbers are ever evolving, the first funding ran out, and KeyBank processed approximately 33,000 applications, resulting in $7.8 billion of PPP funds. We were able to service more than 90 or approximately 90% of our applications for companies with revenues less than 3 million. Additionally, those that did not make it through the first wave will have priority on the second round of funding. And 23% of KeyBank's applications were to LMI communities. So I'm very proud of our efforts and what we've been able to achieve as we navigate these unprecedented times.
Oh, we appreciate it. I know it's been in talking with several of your colleagues, everyone on the team has jumped in. Brian, what have you seen from just the need standpoint, and how are people turning to the Y during this period of time?
Yeah, absolutely. This is something where the Y has the physical building, and you know, our doors may be closed, but we're still serving our community. We're able to really reach through to our seniors. We also have a residence population that we educate and we provide resources for them. Our ability to partner with organizations like the United Way and the Food Bank help resolve the issue of food insecurity. Our opportunities where some of our members are lonely and they prefer to connect with someone in their community and hear that familiar voice. We've opened a call setup so that if they want to continue to receive calls from us during this event, because they missed us or just because it's an opportunity for them to say, the first couple of weeks we were okay, but we're experiencing this now because it's been for a longer period of time. We respond to that in multitude of different ways.
Kyle, I think we've got you back. And
sorry about that. I have no idea what happened. All I can say, it was probably COVID-19 gremlins.
Yes, it was perfect all morning, and then right when we asked the question. But so just want to follow up on some of the things we were talking about before, and one on how you get your employees engaged in a lot of the activities that you guys do at the hospital. And I think we're still having some problems. I don't know if, Kyle, if you might want to try turning off your video and then maybe then just your audio will come across, if you can hear me. So we'll keep going. This is life in the virtual world and webinars, and we definitely technical difficulties is a full part of it. Let me throw this out to everyone. Well, actually, Ellen, maybe I'll turn to you. How is Southern obviously had a huge student population on campus, had to do a lot of things very quickly, and now you're having to deliver to students an education. How has that process been, especially at the School of Business, and how you've responded to employees, to students overall?
So for us, just as for everyone else, it happened very quickly. We told students by noon tomorrow, you need to be out of the residence halls. And, initially we thought it might be for a short period of time. So it was kind of like, take with you what you need for now. As we all know, that changed. And so our campus is completely shut down and we were turned into a field hospital. You know, our field house, the Moore Field House was set up with 350 hospital beds. Our residence halls were set up as housing for first responders and for some patients that had been dismissed from hospital but still needed to be isolated. So we completely pivoted from what's our normal to something very different. Similarly, you know, faculty, staff, and students completely went to a remote learning environment. And I won't say it was seamless, but it's been okay. And we've been able to work through the challenges. You know, right before we got on this broadcast, the panel and I were talking just about how each of us are coping. And, you know, one of the things that I would say that I'm hearing from students and from faculty and staff is, you know, in many homes, there's one computer. And we now have maybe mom and dad trying to work from home and a college student and some younger siblings. They may or may not have internet access. So it's, you know, those are the kinds of things that we've worked out, and we have established funding to support students who need computers, who need internet access, and to really ensure that, you know, the education goes forward. You know, some of the things that we're talking about right now is, are we going to be able to do any kind of a commencement? We're holding a date in August at the Webster Bank Arena. We hope we can do something, but we just don't know. And just this week, we started talking about, we're going to be fully online for the summer. And we've just started talking about what is the fall going to look like. And that's a little bit discouraging to think that we may not come back, you know, the way we normally would in the fall, but we're planning out a number of different scenarios.
Great, thanks, Ellen. And we do have Kyle back with us. So Kyle, we were talking about getting employees engaged with all the activities that you have at Yale New Haven Health.
Yeah, we actually have a robust volunteer service. It's actually, interestingly enough, every year we do something called Know Your Numbers, and we actually ask our employees to get their blood pressure taken and their blood work done, so they get a discount on their health insurance. This year, we're actually looking to include volunteerism for all of our employees, which will hopefully incentivize even more people to come out. But we have incredible volunteerism from a group of people who are doing some incredible things every day. So it's really nice to see. We actually have a lot of our folks on boards in the communities, as well as, you know, I hear about stuff on a daily basis that I didn't even know was going on, where people are helping different organizations, their Girl Scouts, their soup kitchens, things of that nature. And during the holidays, it's just overwhelming what we see coming out of our employees.
And Kyle, obviously with the COVID-19, I mean, no organization has been put to the test to responding to their employees, responding to the community more than hospitals. How have you guys been able to cope with that and still be a real rock for all of the staff there at the hospital, and also give everything you have to the community at this time?
Well, you know, first off, I would like to thank the community on the hospital's behalf, because one of the first things we did was we actually went to the community and said, can you help us get PPE? And I think everybody knows what PPE is now, personal protection equipment. And to a person, we just had some incredible donations. We had people who went into their basement and found the N95 masks that they were using for painting and donated them to us. And we've had over 7,000 hand-sewn masks given to us from all the sewers and the quilters out there, as well as companies that have donated all of what they had for their PPE. It's amazing to me who else uses PPE. You would never think about that. And I want to give a shout out to Gateway, because they donated quite a bit of medical equipment for us to do a stand-up hospital at Bridgeport. Bridgeport Hospital actually has a tent outside of their facility for step-down care, and they were actually able to donate a lot of stuff to us to be able to create that. But as far as our, help our employees being involved. We've had people who are stepped up to the front line, nurses who weren't ICU nurses who have now become ICU nurses, as well as we've shared resources throughout our system. So we've had nurses and others from New London working in Greenwich, because as you probably realize, Greenwich became a hot spot very quickly, being so close to New York. And we've shared resources in that respect, and our employees have stepped up. And the other thing that I have to mention is the donations of food that we've been getting from all of the restaurants, all of the people in the community. I don't think anybody if our staff doesn't come out 10 pounds heavier, I wouldn't be surprised. But we've had incredible donations on a daily basis of food from different restaurants and companies.
That's great to hear. Great to hear. So here's a challenging question for everyone. Obviously, we don't know what the future is going to look like after we start to get through the virus, but we all know there's going to be a lot of need. So just any thoughts right now on, and maybe not just your individual company, but how the corporate community and businesses overall will be able to respond to the needs of the community going forward, because it's obviously going to be very different. Keisha, you want to jump in first? Sorry, I know I'm giving you the tough question here. Predict the future.
I think that the theme of this webinar, we're all in this together, is what it's going to take. It's going to take all of us as a community to come together to support, to ensure that our nonprofits specifically make it out on the other side of this. I know that not just KeyBank, but many organizations who have philanthropic investments are allowing a lot of grace and accelerating payments to organizations. They're allowing payments to be repurposed to ensure that organizations have the funding that they need. I can speak specifically on KeyBank's behalf that our new investments will be targeted to COVID sustainability afterwards, after the pandemic. So we definitely all must collaborate and come together on the other side of this.
Oh, that's great. Thank you. Brian, your thoughts?
Absolutely. I think I think Lakeisha got it right on point. It's all about, we are in this together. And how the why will come about it is, I think one great example is summer camp. Summer camp across the globe is going to change. And we continue to respond to this pivot. And as we sort of come out of the experience that we've all had, I think it's a great way and it's a great time to inspire those experienced professionals to give back in a way by helping shape a child's summer camp experience, or giving back to a nonprofit or another organization where they can give a gift in kind, where their time may not necessarily be a monetary gift, but something where they can participate and help shape lives coming out of this with their experience. I think that's going to be critical to engaging the community and giving back to the community in a new way. And each organization will define what way is best. But I think it'd be very great to see those experienced professionals say, we've learned this. Let's kind of navigate through this and come out together.
Ellen, I'll twist the question a little bit. Obviously, the students that you have that are graduating, they're entering a much different workforce than it was a month ago. The employment landscape is very different. What are you telling your students, and how do you think that the business community overall can help support them? Obviously, jobs is number one, but what are you seeing and telling to your students?
Yeah, that's probably our biggest challenge right now, Garrett, is the graduating seniors. And what we continue to do remotely is to prepare them for the next step. So our Business Success Center, which is supported by Wells Fargo and other community partners, still does virtual interview preparation, one-on-one, face-to-face on a screen like this, where they're doing interviews and giving feedback to the students, preparing them for resumes, preparing them for interviews, connecting them. And so I guess I would say, to answer the second part of your question, how can the organizations and businesses help? we need to know what your needs are, and we need to know how to prepare the students and the graduates appropriately. You know, we want to make that match. We want to help. We want to help you. We want to help the organizations get back and get up and running and as back to normal as quickly as they can. And I think the best way we can do that is to make sure that we are providing you with the employees with the skills that you need. So a lot of what we're doing is continuing our work, but it's, you know, from a remote, and it seems to be working for students.
Hey, Kyle, same question we were asking about what the outlook looks for after we get through COVID, how the need that's out there, how communities, companies can continue to give back. And definitely, I think on the health side, COVID has taken up so much of the breathing room that there's a lot of other health needs out there in the community as well.
Well, we'll continue as best we can with our community needs, and especially our community health needs assessments and reviewing what's needed in the community. I think you're right. We're going to have to work in this kind of format going forward for a while. But, you know, we do a lot of telehealth right now, which is very interesting. That has really exploded as far as people getting their healthcare needs taken care of. We actually have some people who are a little bit fearful of coming into the hospital given what's going on. So, so we want to keep that in mind. And masks, hand washing, gloves. I mean, but we'll be out there. We'll be out there because healthcare is not it's not a computer sport. You definitely need to be with people at all times. You can't really fully assess somebody by video or by phone. Sometimes you have to have them come in. Sometimes they have to get some kind of injection or some kind of care. So we'll definitely be doing that. And we'll be making sure that people are fully prepared for it.
Well, thanks. And we did have a question about what's the chamber doing, and you know, it's definitely working with businesses out there and first trying to get them through these stimulus programs, but then trying to work with them as to how they operate in this new normal, whether that has to be investments in technology or changes to their physical location, because there's going to be a lot of things that are different once we get things restarted. One kind of final question for everyone on the panel. And we'll kind of step back from COVID-19 for a moment, but even for a small business, what would you say, how can they engage in being good partners in the community, whether they're on the large size or they're even a very small 1 or 2 person operation? What would be your advice for giving back and getting engaged with the community overall? Lakeisha, I'll start with you.
I would suggest our networks, taking advantage of the support resources. For example, here at Key, we have an affinity group called Key for Women, and our Key for Women supports women in business, entrepreneurs, women business leaders. You do not have to be a Key client to take advantage of the support network. Leverage these support networks. We offer opportunities to connect, to provide guidance for small businesses, and just the networking piece of it, I think, is going to be instrumental.
Kyle?
I'm almost afraid here. I'm afraid I'm going to lose you. I would say probably volunteering here at the hospital. And I know for small businesses, it may be difficult to let people have some time, and I'm not necessarily suggesting that, but tell their employees about opportunities here at the hospital. And you'd be surprised what we have as volunteers. We have a whole clown care unit here, which is actually something that comes out of the Big Apple Circus. And we have people who are actually in Smilo's lobby on a daily basis playing instruments. I mean, not right now, given what's going on, but I'm sure that'll start up again. And it's not only something that the patients enjoy, but the employees love it. I love walking through that lobby and hearing someone on the piano playing a great tune or playing a trumpet. We have all kinds of instruments of that nature. Giving us a call and finding out what we need and how you can help. And maybe, whatever your company creates, maybe it's something we can use here at the hospital.
Thanks. Brian?
Yeah, absolutely. I'd like to echo Kyle on that one as well. It's volunteering. Just swing by, giving us a call. Even those that are with small businesses of like you said, 1 to 2 people. Just stop by your local, YMCA. Walk in the door, and there's tremendous opportunity. Whether it's even just coming in for a workout, and you may be meeting someone that could be a business owner at the treadmill. You could be educating someone on how to use a piece of equipment, just in a simple conversation. I think that amongst the opportunity to inspire children, which we have running around our facility all the time with different programs, keeping them engaged. Everyone really likes to live their inner childhood, and I think volunteering is a great way to do that, especially with kids.
Dean Durnan?
I would say that this is something that's so important to us at the School of Business. Our tagline is change for good, doing good while doing well. And it's something that we weave throughout the program and want the students to think about. So we encourage them to think about boards and professional associations and places where they can connect and they can make a difference. And I think for our young people to learn that early on, and for that to be part of their professional development right from the beginning is so important.
Well, I want to thank all of our panelists and definitely echo the words that we had for the hospital and everything that Yale New Haven Health is doing in this period. We appreciate everyone joining us for our first councils and conversation. And again, thank you to Southern Connecticut State University School of Business for being our host, especially in these unique times. Hope everyone has a great day, and stay in touch and stay healthy.
Thank you, Garrett.
Thank you.
Thanks everyone.
Thank you.
Stay safe.
Thanks, everyone.
Thanks.
Yeah.